This is Miss Kasey. Kasey is one of our chronic fluid patients, and she has volunteered to do a demonstration for us today. So what Nikki is doing is she's putting the skin in a tent position and just slipping it right underneath the skin. After that, she is going to unroll the clamp that is blocking the fluids, and the fluids are going to start flowing. One of the biggest things to do with this is to make sure your cat's in a position where it's comfortable. Be that on your lap or on a table, on a counter, wherever they are going to be the most comfortable. Ideally, as you can see, you do not see any fluid at this moment where it is flowing, but the higher up the fluid bag is from the patient, the faster the fluids are going to flow. Kasey happens to get 100 mLs of fluids, so each one of these numbers is 100 mLs. Each one of the lines in between is 50 mLs. So I'm assuming most of you do not have an IV pole at home, so feel free to hang it from anything you have available, be it a hanger, a friend, family member, or a lampshade, anything of that variety. But the higher the better. Some doorknobs even work for that, or door ledges. As you can see, Kasey is a fairly talkative, pretty spirited girl, but she's had a lot of practice at this and is doing great. I'm not sure how well this will show up, but the water is almost coming out in a full stream. So the faster that is flowing, obviously, the less time they need to sit there. If at any point in time you notice the bubble getting too tight or them becoming uncomfortable, feel free to either stop for that moment and move to a different area, or just abort for that time frame and try again a different day. When she is done her fluids, we will clamp off the blue clamp and roll down the little rolly ball, in all technical terms. And then pinch the area where the needle is right above it. Sorry, I'm getting personal. Pull that out. And then just hold that area for just a moment. Then we will recap the needle. And it is up to you. You can either change it at that moment or change it before your next fluid use, but always make sure to use a new needle before poking the patient, so that way the needle is not dull and is sterile. If you have any questions, never hesitate to give us a call. Thank you, Nikki and Kasey, for this demo. Yay! What do you think, Case?